I'm going to be performing a bedpan skill. Most of my skills will be verbalized. First, I wash my hands, gather my supplies, which is my incontinent pad, the toilet paper, trash bag, wash blanket. I gather all my supplies. Then I go into the room, knock. I wait till I come in. Then I'm going to greet. Good morning, Mr. John. My name is Kune, your CNE, and I'm here to help you with your bedpan. Is that okay? Once I said it's fine. First, I check his wristband to make sure I have the right person. Then I put on the privacy curtain. I check my brake. Once I check my brake, I put away the call lights. Once I put away the call lights, then I leave the bed up to walking height, comfortable walking height. Once I leave the bed up to the comfortable walking height, then I'm going to cover my patient with the wash blanket and take away the normal blanket he's using. So then I'm going to put on the side rail and excuse myself for a second to get my bedpan. I knock, I come in, I have my bedpan already. So I'm going to put my bedpan. I get the incontinent pad, put my bedpan on the incontinent pad. Then I put on my glove. Once I put on my glove, I put the incontinent pad on my residence, move my residence over. Then I put the bedpan. Once I put the bedpan, I return my residence back to make sure it's comfortable. Then I put the bed in a Fowler position. Once I put it on the Fowler position and it's okay, I'm going to give him, put the side table, put the hand sanitizer there, I put the tissue, toilet paper there, and the trash bag. So I'm going to give you 5 minutes. Here's your call light. In case you need me, just call me back. I'll check you back in the next 5 minutes. I put the side rail up. I put the side rail up and put the bed down to a lower position. So I'll give him 5 minutes. So 5 minutes is over. Are you all done, Mr. John? He said yes. Okay, good. I'm gonna put the bed up in a comfortable height. Then put the bed down in the supine, make it in the supine position. Once it's ready, so I'm going to turn my residence to the other side, get the bedpan, put the bedpan on the table, cover it with a continent pad. Then I'm going to help the resident wipe using the toilet paper. I wipe, put it in the trash bag, wipe, put it in the trash bag, wipe, put it in the trash bag. I turn my residence over, once I tie the trash bag, I tie it back with the hand glove I have on, I put it in the trash. Take away my glove, sanitize my hands. Once I sanitize my hands, I make sure my residence is okay, give him the call light. Once I give him the call light, put the side rail up, put the bed down to the lowest position. Once I've done that, then I have my glove on to help my resident sanitize his hands. Once I sanitize his hand, I put the bed to the lower position. Once I put the bed to the lower position, I ask if there's anything else I would like to do for my residents. If it says no, yeah, then I'm going to put on my glove, another glove. Once I put on another glove, I take my bedpan to the toilet. check for abnormalities. If there is none, empty my bedpan, rinse, dry, put in designated area. Then I'm going to take away my glove. Take off my gloves. Once I take off my gloves, sanitize my hands. Come back to the room. Sanitize the table. Make sure everything is clean. Once everything is clean, put the table by the bedside. Give extra assistance. Give extra assistance. Once it says no, then I'm going to open the privacy curtain, wash my hands, record and report.